As a result of this book, I would like to see every person in the United States aware of the risk of traumatic brain injury and to take the steps necessary to prevent it. We can't eliminate brain injury entirely. There are going to be car accidents, people are going to get shot, people are going to fall, but there are many things that we can do to reduce the risk of serious harm from brain injury.
It was a drinking accident. I was accidentally shot in the head with about .357 Magnum.
I'm confused.
It all combined into a deadly, tragic result of Matthew being hit over the head repeatedly with 40-ounce beer bottles.
For some reason I was waving the gun around and it went off and caught me in the side of the head. Came out the top. I just kind of remember it as a dream. Just little glitches here and there. I remember the machine flatlining. I remember that sound. They called my mother, the doctor did, and said, "Come get your son, he's brain dead."
Since we've been treating Shane's spasticity, we've had to sort of play the system or the health care that's been available to him. And little by little, with multiple admissions, we've been able to get him to a point where he can function more and more independently. He's required some surgeries to get there, and he's going to require a lot more assistance depending on what we can get him. But hopefully now, eventually we're going to get his life where he'd like it to be, of course with his participation.
The rehabilitation process has been very scary, very hard. Sometimes you want to just quit. But this whole ordeal has kind of made me a different person, you know. Made me a lot stronger mentally. I've had to. So right now I'm the $6 million man. I have a plate, shunt, pump. I got all kinds of spare parts. Walking is fun again because I'm 6'2" again. You know, I'm not 3.5 feet in this chair. So I enjoy walking. I enjoy just standing in a standing frame. I don't feel like I do it very well. You know, I'm not John Travolta yet or anything, but I'll get there.
What people don't realize that in addition to the horrible loss of life as a result of brain injury, that many people survive, but they survive with disabilities ranging from permanent unconsciousness to physical handicaps to mental disorder to behavioral problems. And those injuries are invisible to the general public, but they're tragedies and disasters to the patients and their families.
Our life on July 28, 1995, took a dramatic, sharp turn. Everything changed. Absolutely everything.
I wish that this was just a bad nightmare. And I wish sometimes that I would wake up and it would just go away.
Matt was out with a bunch of his friends on a warm summer night, no different than any other 15-year-old, 16-year-old teenager. He was at a parking lot where they were hanging out, and he was set upon by 4 other teenagers from a rival group of kids, not a gang.
He was brought home by friends, delivered to our driveway. His eyes were fixed and dilated. We both, my husband and I both knew that Matthew was very critical.
Matt spent a month in a critical care unit. Matt was 7 months in a coma, but he did wake up. He does know us, and we love him as much as we loved him the day before this ever happened.
Matt has been a patient here for 2.5 years. He's incredibly ill. He's in what we would term a near vegetative state, and some days he'll cry for 14 hours straight. And because he has a tracheostomy, he doesn't make any noise, and so I think that makes it even worse.
I'm not angry. I don't have any grudge or vendetta. It doesn't help. I used to get angry. It just used to get us, literally tear us down, rip us apart. I don't have any anger anymore. My focus is strictly on Matt.
Sometimes it's just difficult to be a parent. Sometimes it's very hard to concentrate on the other 2 boys when Matthew's up here sick and I'm at home. And, you know, as a parent, you try to divide yourself equally anyway. but sometimes I feel like we're spread very thinly.
We've lost most of our family from this. They've left us. They've gone on to live their lives, and that's not uncommon, but it hurts. But, you know, Matt's old story, it's old news, but it's something we're going to be living with for the rest of our lives, so we don't have much family left.
My children who were very independent and not attached to the hip have become real close with us. They've become insecure. They like their mom and dad home. They don't feel that pressure to go out, even with their friends. They would rather do things as a family, meaning the four of us at this point. And they look at their parents who are emotionally shot and tired, and they've seen us get gray, and they've seen us get heavy, and they've seen us get thin, and they've seen us laugh, and they've seen us cry, and, you know, life goes on, but in a different way.
It doesn't have to happen. Brain injury is a preventable disease. It's preventable in violence, it's preventable in car accidents, it's preventable by drinking. It is a preventable disease. It need not happen.
Me and my wife met about 14 years ago. Country and Western dancing. She was a teacher, I was a teacher, and kind of at the sort of the end of the urban cowboy period. And we met. She was a dance star. I was just a big wannabe. We started competing a few years after we got married. We got married about a year after we met.
Lori was injured several months ago in the fall, and she had been driving with her 2-year-old who was strapped in a car seat. She apparently hit the back of a loaded truck, and she was probably going about 60 miles an hour.
When we got to the hospital, they handed me the baby immediately. She was fine. Life flight people, you know, kind of ran down basically what had happened. And so I was probably being real together. Wasn't together, but I was acting real together.
Lori's personality is very different from the person that she was before her injury. When you see videotapes of them, I should go back, they were the international champions for country western dancing last year. Her memory is very poor. Doesn't necessarily remember that she was home for the weekend or that she saw her child that day.
We had $1 million policy, but we only had $30,000 worth of rehab. And that got to be kind of difficult because when we got ready to use our $30,000, they told us that we had already used it. It took bringing in a lawyer to even get that amount of money freed up. $30,000 is about less than 30 days in a rehab center. And rehab looks to be like a 2-year process.
This is a community reentry program for people with brain injuries. We are the end of the line in rehabilitation. Our job is to take folks after they've been in a rehabilitation hospital and try to put them into a real-life setting and help them with whatever skills they need so they can live as independently as possible.
Tell me a little bit about Tyler. When was she born?
Well, she's now 10 months old, and she was born February 26th of this year. What is this year?
96.
96.
Her recovery is kind of scary because she's in a lot of ways not the person she used to be. I love her because she's who she is. And
I've got a great guy. But I have changed from all of this.
My greatest frustration in this job is that brain injury has just been totally ignored for years and years by the medical profession. It's you have the head injury and that's it. Go to a nursing home, go back home and live the rest of your life as best you can. I'd like to see some focus on let's help these people. Again, it has been ignored by the medical industry, it's been ignored by the insurance industry, it's been ignored by the population in general who just don't want to have to deal with somebody after they've had a head injury. There's a lot of folks out there who have a lot to give to society even after they have a head injury, and we need to do whatever we can to help these folks.
As a fortunate survivor of a traumatic brain injury, I have spent a lot of time visiting facilities that help people not so lucky as I try to regain their capacities. And every time I see a brain injury rehabilitation center and the persons who are there, I realize that they have to live their life in slow motion. They can't walk as fast, they may be wheelchair bound, they may be unable to move their limbs effectively. They can't think as fast. They can't talk as fast. It must be a terribly, terribly difficult thing to remember what it was like when you could do those things and now you can't. And we have to, as a society and as individuals, respond to the needs and the problems that people with traumatic brain injury face every day of their lives.